Hello and welcome. You're watching our special show, Coronavirus Facts versus Myths. I'm Gargi Rawat. This is the show where we get you all the latest on the pandemic and all the vaccine news. Well, first up, let's take you through the numbers. And with 1.34 lakh fresh COVID cases, the declining trend continues, the Health Ministry said, adding that active caseload has further declined. India recorded 2,887 deaths since yesterday. 3.37 lakh people have died so far in the pandemic. The overall case count stood at 2.84 crore. The positivity rate is 6.21%, and the positivity rate was recorded below 10% for the 10th straight day. Now, the big focus on the show today is vaccines, our vaccine drive, and the pace of the vaccinations in the country. Now, India has administered over 22 crore vaccine doses since January and has an aim to vaccinate all eligible people by the end of this year. But if we talk about people who have received 2 doses, only 4.53 crore people have got both doses of the vaccine, which is 3.3% of the entire population. At the start of the vaccine drive, the government had aimed to fully vaccinate 30 crore people by the end of July. But clearly we're going very slow on that aim, and now the government has said it will vaccinate the entire adult population by the end of the year. But to achieve that, the government needs to vaccinate at a rate of over 70 lakh a day. In fact, the government has said that by July, August, they will be vaccinating at a rate of 1 crore a day, and that by the end of the year, they will vaccinate the entire adult population of 108 crore people. And this is when we're currently vaccinating at a rate of around 20 lakh a day. Now, if we compare with the United States, India has caught up to the US in terms of the number of people who have received at least 1 dose of the COVID vaccine. But just take a look at the difference in the percentages of the population. The US nearing nearly 50% of the population covered with just 1 dose of the vaccine. And India, while it has vaccinated with 1 dose the same number of people, it still remains a very small share of our entire population. So that's the big focus on the show today, a look at India's vaccination drive. Well, to talk about this, we're joined by Dr. Suresh Kumar, Medical Director, LNJP Hospital. Thank you so much, Doctor, for joining us. So, we're aiming very high. We hope to vaccinate the entire adult population by the end of the year. But right now, if we take a look at our vaccine rates, it's very, very worrying.
Definitely, madam, as you have shown the data of entire country, the speed at which vaccination is going is still we need to have very rapid vaccination, because only 3.3% received 2 doses and about 12% received single doses. So it's very, if you want to protect our population, entire population from third wave, we need to speed it up, because we have seen that those who were vaccinated, the impact of disease was not seen in them, or only mild disease was seen in few where they have already received the vaccine. So it is very, very important, very vital that if we vaccinate the entire population, as the Europe and the USA and England has done, that they have vaccinated their entire population in a very short period. So we have the capacity, we have the enough manpower, and only problem is the availability of the vaccine. The manufacturing capacity government has already increased, and we hope that the number of vaccine doses is definitely augmented. And the June and July, they are the 2 months where we see a lot of vaccination, and speed is also going up, and all the state governments, central government, everybody is trying their level best to increase the vaccination capacity.
Right. We're hopeful of getting more vaccines in our kitty. Currently, we have only 3 vaccines. That's, with the Covishield vaccine, and the Sputnik vaccine is the latest one. We're hopefully getting the Moderna Pfizer vaccine soon, and hopefully others as well that can add to our kitty and can, lead to a big boost in the vaccinations, isn't it?
Definitely, when we have the availability of all the brands of vaccine, whether they are available in the Russia or in the Europe or in the USA, and we are more comfortable if large number of vaccine manufacturers are giving vaccine in India, as every government is trying like this vaccine from Hyderabad is also being supplied, and we hope that the Delhi government has already plotted the global tender, and we may receive more vaccines soon.
Right, and if we talk about, if I want you to tell our viewers why it's so important to vaccinate fast, because we've had this virus circulating now for, over a year and a half already. We've seen a certain mutant variants emerge that become, more infectious. We're still studying whether they cause worse disease. But if we allow this to circulate even further, that is the fear, isn't it, doctor, that we'll see more such variants emerging?
Definitely, because virus, if you see the dynamics of the virus always go on changing itself, and we have new strain because it's natural in the course of virology that all virus mutate with the time. If they don't mutate, they automatically die out of the environment. So virus always make constant changes, and new strains are emerging. We have seen many new strains coming, and now most of these vaccines are very effective against all the mutant variety of the virus. So that is the good thing, that even if the mutation is there, all these vaccines, whether they are manufactured in India or abroad, most of these vaccines are very, very effective against all these strains of the virus.
Right, and Dr. Kumar, now the urgency is also to get children vaccinated, isn't it? And that's one of the ways to prevent a third wave, because let's face it, the children also carry the infections and spread it among people. And, a lot of people who receive the vaccine after 6-8 months, we're not very sure of the kind of protection they'll still have. There is immunity erosion as well. And therefore, if children too are vaccinated, at least that will lead to more protection of people in general, isn't it?
Definitely, some of the countries have already started the vaccination of children below 18 years, and Indian government has already started the study of efficacy and safety of vaccine in children. So study is already going on, and we hope that the study will be concluded soon, and most countries have already started in this group, because this group is more prone for future virus infection, COVID infection, because all age group, either they are infected naturally by the COVID infection, or they were given vaccine, and the 45 plus age category already received the vaccine, and now vaccination is going at a very fast pace, very fast speed in the 18 plus category also. So only now children are remaining. So we need to protect the children also. But there are no studies from India that whether this efficacy and safety of vaccine in below 18 years of children is there or not. So we may have our own robust data after this study of efficacy and safety.
That's the only way to achieve this herd immunity, which is what all doctors talk about. Dr. MC Mishra also joining us on the show, former director of AIMS. Thank you so much, doctor. We're talking about how the government aims to vaccinate all adults by the end of the year, and it's a very ambitious target, but so far the pace of vaccinations have been a huge worry.
Yes, Gargi, I don't think it is that much worrying as to you. To us, it does not look that much worrying, because we have already vaccinated 22 crores of people, at least with one dose, but as of yesterday. And the vaccination process will be speeded up as soon as we receive more doses of vaccine, which I think Serum Institute has already said in June they will be giving us around 10 crores doses for the month of June, and in July, and plus the Bharat Biotech co-vaccine doses would be also increased. And from July and August, I think the doses available will be much higher. And we hope that by September, we should be able to covering around 60 to 65 crore population, at least getting one dose of vaccine. So if you look at the total number of vaccinations in the country and compare with other countries like US, which has 1/4 the population of India, and UK, if you compare 60% population has been covered. It is 6 crore, 1/4 of UP. And from that perspective, you have to look at vaccination drive. I don't think you can look at that they have vaccinated these many and we have 3% 2 doses and these many 1 dose. So you have to look at our population also, and I'm sure the way we are now looking at the bouquet of vaccines being available from July onwards, like Sputnik has not yet given too many doses to us.
Yes.
But the Pfizer says they can give 5 crore doses in September. So all these will help also in augmenting, but we have to depend more on our own Covishield and Covaxin, which are supposed to give us 750 million and 550 million by December, or maybe more also, because this is not a one-time vaccination which is happening. We will need these vaccines, each one of us, as a booster also, even if we have got 2 doses in March or February. By approaching February, we all will need the booster of these vaccines. So I think that is where we have to look at. And once we reach by September, we'll have at least 50% population covered. And if you look at UK, 60%, USA 40%, with that their condition and their situation became very favorable. So we also expect that if we are able to vaccinate 40 to 50% population by September, our situation will also likely to get much better than what it is today.
All right. Well, that's a very optimistic note. And hopefully, yes, we will cover 50% of the population by September. That is the hope. Thank you so much, Dr. Kumar and Dr. Mishra, for joining us on this discussion. Dr. Mishra will, come back to you for the question-answer segment later in the show. Let's now talk about the treatment for COVID, and the use of steroids has come into a major focus recently. Steroids, remember, have become one of the most common medications given to patients struggling with low oxygen levels or those who are on ventilator support. And while experts believe that steroids can prove effective against severe infections, the lack of attention to details regarding steroid intake, timing, duration is proving dangerous. Now, it's being seen as one of the reasons perhaps for increased cases of mucormycosis in the country. Well, to talk more about this, we're joined by Dr. Karthik Cherabuddi, an infectious disease specialist and epidemiologist, University of Florida. Thank you so much for joining us, Dr. Karthik. Now, there's a lot of talk of steroids treatment in COVID, and while it is one of the treatments that is being proven to help, if you could explain to us also just what steroids are and how they help during COVID.
You're right. Steroids are extremely important in the treatment of COVID. It's one of our most proven therapies for COVID. The important thing to understand with steroid use is they are broad drugs that decrease our own immune system. And why do they play a role in COVID, right? Essentially, what happens with COVID is people who get sicker tend to not react in time to the virus. So their immune system, which protects us from COVID, reacts very late. And after it reacts late, it sort of overshoots up. And when you have this overshoot, sort of an uncontrolled immune response, that's when people get really sick with COVID. This is sort of the second part of the COVID phase, which is the immune phase. That's when people get really sick. And steroids dampen down the immune system, so they work extremely well in that phase. What can they do otherwise, which can be a problem, is if you use it in the first part where your virus is dividing, our own immune system fights the virus from dividing. If you give steroids in the early phase when our body's trying to fight off the virus, you will actually decrease our body's immune response and make the virus divide even more and cause more harm.
Right, doctor. So, everybody talks about how the timing of giving the steroids is so important. If you could tell us more about that.
That's completely right. What we've seen this has happened the world over in many ways. When you have this huge surge and we know the hospital systems are overwhelmed, right? It's harder to find beds. It's harder to find relevant supplies of medications or oxygen. People, including physicians, want to do everything they can to keep people at home and not let them worsen. The downside of it is you were using these therapies at the wrong time potentially, and also worsening people possibly by using them at the wrong time, right? And What's proven with steroids is low-dose steroids, not high-dose steroids. Low-dose steroids used for a short interval of time make the biggest difference in this immune phase of disease. They don't work any other time. 80 to 90% of people who are infected with COVID will never require steroids. So I think that's the first thing we have to think is only maybe 10% of people who've had COVID will need low-dose steroids, which tend to be where they use methylprednisolone, 32 milligrams a day total, prednisone of 40 milligrams a day total, dexamethasone of 6 milligrams per day total, and that's for 5 to 10 days. I mentioned the doses and the drugs because that's the first thing you should do when you get the prescription. Look up what the trade names are, search it on your phone, on a browser, and see what the scientific name is. And good doctors will explain that to you. It takes hardly a minute. So while the time is precious, understand what medications you're getting and know that if you're getting steroids too early, then it's not the right thing, and discuss with your doctor. Equate steroids with oxygen. Both go together. Oxygen and steroids are given at the same time in managing COVID. If you don't need one, you don't need the other.
All right. Thank you so much, Dr. Karthik. So very important to monitor the use of steroids and not use it in mild illnesses. Well, with that, time for us to slip into a short break. Coming up after the break, we'll answer some of the frequently asked questions online. Stay with us. Now for our special campaign segment, Vaccinate India, in partnership with Google, where we discuss questions that many of you have about COVID and vaccines and often look up online. Joining us, Dr. M.C. Mishra, former director of AIMS, and we're going to take up a few questions that people often Google. One of the questions that we get very often is, how can I prevent COVID, prevention measures? Doctor, what would you say to that?
That is the most important preventive measure. Each one of us can use with ease, without difficulty. It's not expensive, easily available, and you can customize to you. Maybe these days we are recommending 2 masks. I use 2 masks. Whenever I am riding my car with the driver, I use 2 masks. One of these surgical mask which we put on in our operation theaters, and 1 linen mask. You can safely use it just to guard yourself, because what we have seen, the mask can protect even if the distance is less, and it can protect someone or any one of us up to 95 to 96% times. And even if we contract the virus somewhere, because it's not an airtight thing, and we are breathing, after all, putting on these masks, we are breathing. So with that air, if suppose few virus particles do enter our air passages, the infection will not be severe. It will be very mild infection, if at all. It will pass off very easily. So I think it is the number of particles which we inhale also determine how severe we get the disease. We have seen number of families where 1 odd person got very severe disease, rest of them they recovered without any problem. So I think that has happened in many families. It has happened whether with 10 family members getting infection, 22, 3, 5, whatever. So I think that is something which people have to understand. If you can maintain a distance, closed door meetings, air conditioned room meeting, I think we should avoid those as far as possible. But if we are doing those meetings, first of all, we should try and do the meetings virtually if that is possible. And it is possible most of the times, like we are doing it today. I am sitting at home talking to you without any difficulty. So that is very much possible. And if we are in a room, keep the distance maybe even more than 6 feet. That is what is recommended now, since the virus is airborne when we even speak. When even we are not speaking, we are just inhaling and exhaling our air from our lungs. Viral particles might be shredding into the environment, and they can remain suspended for a few hours. So that is where these simple preventive measures cannot be overemphasized. And this is something which will come very handy for everyone.
Right, so absolutely wear masks, be in well-ventilated rooms, and of course get vaccinated as soon as you can. Another question that's looked up very often, doctor, is self-care during COVID, home treatment for COVID. What would you answer to that?
See, majority of people will recover at home. Majority, 99% people will recover at home. Only 1% people, those who got infection may need hospitalization. And unfortunately for India, that number becomes too big to manage. And that is where we saw the problem. It is not large majority. Large majority will get better whether they are at home or they are in the hospital. They will get better without, as was being discussed by our friend from USA, that if you don't need oxygen, you don't need a steroid. If you don't need a steroid, you don't need oxygen. And that is the kind of scenario. But yes, during the second wave, lot of patients, even with moderate to severe disease, were treated at home and with excellent results, excellent outcomes by experts, critical care specialists. And how it is beneficial at home, because if you are sick, somebody near and dear to you will look after you with food, with giving water, with fluids, whatever your requirement. Maintaining distance, obviously, taking all preventive measures, and that is, nobody else can look you after much better than your own family. This is something which one must remember, and that is where even people with kind of a CT score of 22, 21 have recovered at home, not required hospital. Maybe they required some oxygen, high flow oxygen, which could be managed at home, and they recovered. Because many a times what happens in a hospital, you are not so closely monitored as one should be able to do that because of the large number of patients, less number of medical professionals looking after these patients. So you may not get that much attention in hospital as you would expect
it's
otherwise.
important to be in touch with your doctor even while at home and keep monitoring your levels and reporting back to the doctor. Thank you so much, Dr. MC Mishra, for speaking to us here at NDTV.
Thank you.
Thank you. Well, that's all the time we have on the show. Thanks so much for watching. Goodbye.